Do you sometimes feel fever, joint pain, or notice a pink rash spreading on your skin after a mosquito bite? If yes, it might not just be a cold, it could be Zika virus. Zika is a health problem that spreads quietly, often with mild symptoms, but it can be dangerous, especially for pregnant women. Imagine you're enjoying a picnic in a tropical area and get bitten by a small mosquito. A few days later, you feel a bit sick, nothing serious, but something feels off. That's how Zika often starts, sneaky and light, but it can lead to big problems. It became widely known during outbreaks in places like Brazil, where babies were born with smaller heads due to Zika infection during pregnancy. So even if it feels like a small illness, its effects can be long-lasting. What actually causes Zika? It is caused by a tiny virus named Zika virus, carried by a specific kind of mosquito, the Aedes mosquito. This is the same mosquito that carries dengue or chikungunya. Think of this mosquito like a tiny delivery driver, but instead of packages, it delivers viruses through its bite. These mosquitoes love warm, wet places and bite mostly during the day, especially around sunrise and sunset. You won't see them coming, but if one bites you after feeding on an infected person, you could catch the virus too. Besides mosquitoes, you can also get Zika through sex with an infected person, or from a mother to her baby during pregnancy. So it's not just bugs, it can spread in more personal ways too. Now, how would you know if you have Zika? Many people don't even realize they're infected. Almost 80% feel nothing at all. But if symptoms show up, they usually start 3 to 14 days after a mosquito bite. Picture this: you wake up with a low fever, your eyes are red and sore, called red eyes, you feel tired, and a light rash pops up on your arms and legs. Your joints might ache slightly, but not like broken bones, more like mild stiffness. These signs often feel like a mild flu and go away in about a week. But here's the real concern. If a pregnant woman gets infected, the virus can travel to the unborn baby and cause brain problems, like microcephaly, where the baby's head is smaller than normal. So even if your symptoms seem minor, the impact can be serious for others. How do doctors know it's Zika? They don't guess, they test. If you've been in a tropical area and show symptoms, a doctor may take a blood or urine sample to check for the virus. Think of this like scanning a barcode. The lab looks for Zika's genetic signature in your body. It's important to get tested because Zika can look like dengue or chikungunya, which are more severe. There's no specific medicine to kill Zika, no magic pill yet. So treatment is like giving your body a support team. Rest helps, drinking water avoids dehydration, and medicines like acetaminophen, Tylenol, reduce fever and pain. But avoid aspirin or ibuprofen until dengue is ruled out. It could cause bleeding. For pregnant women, extra ultrasounds may check the baby's health. Most people recover fully, but the focus is on comfort and caution, not cure. Can we stop Zika before it starts? Absolutely, and it starts with stopping mosquitoes. Imagine your home has old tires filled with rainwater. That's a mosquito nursery. Empty them, cover water containers, and use screens on windows. When you go outside, wear long sleeves and use insect repellent with DEET. It's like putting up an invisible shield. For travelers, check if your destination has Zika. Some countries post alerts. And if you're planning a baby or pregnant, be extra careful. Use condoms or avoid sex if your partner has been in a Zika zone, because yes, it can spread that way too. Prevention is like wearing a seatbelt. It doesn't stop accidents, but it cuts the damage. What's new in the fight against Zika? Scientists are working hard. Right now, there's no approved vaccine, but several are being tested. Think of it like training your body's security team to recognize Zika before it attacks. In labs, researchers are using smart tech, like gene-editing mosquitoes, to create bugs that can't spread the virus. Others study how Zika attacks nerve cells, hoping to protect babies better. Some studies even explore using weakened Zika virus to target brain cancer cells. Yes, turning the enemy into a weapon. While we're not there yet, every study brings us closer to stopping Zika for good. So even though it's quiet now, science is loud and active behind the scenes.